The Gambia Committee on Harmful Traditional Practices Affecting the Health of Women and Children, GAMCOTRAP, a feminist human rights organization advocating for the sexual and reproductive health rights of women and girl children, hosted a capacity building training program with other various stakeholders at the GAMCOTRAP Conference Hall on the introduction and usage of a new clinical app named Pocket Patient MD. Dr. Mark Wing from the United States of America facilitated the training session for the day. The training's objective is to increase the effectiveness of data management and accessibility in the Gambia through the use of the Pocket Patient MD app, a technology tool that enables doctors to conveniently create and manage digital patient records and allows patients to monitor their own health and health care. The participants comprise civil society organizations, the Ministry of Health, staff and volunteers of GAMCOTRAP and GBOS, who were given the knowledge and skills they needed to effectively use the app to gather patient health data and supply information for efficiently tracking of diseases. The Executive Director, Dr. Aissatou Touré, in her remark, emphasized the importance of utilizing digital technology to advance the country forward.
I am not going to dwell very much on this because you already see a name that is appearing many times on this paper. But as the head of the institution and being the contact person to facilitate this process, I want to say that we as GAMCOTRAP have been working on sexual and reproductive health rights of women and girls, and we've been doing quite a lot of advocacy centering on women's health and looking at harmful practices that affect the health and well-being of women and the sexuality of women in order to promote their health, in order to promote and address domestic and intimate partner violence because of the situation that women do find themselves, including girls. We deal with women's rights issues, gender discriminatory practices, and we also try to do advocacy on changing certain practices that is also inimical to the health and well-being of men. You know, this year is the year of technology, women and technology. And quite a lot of things are being used to use technology to move and to address you have telemedicines, you have all sorts of things going on. I am not the expert in them, but some of you, the doctors who are here, the healthcare providers who are here, and also the women leaders who are also present here, including some other grassroots activists who are also working with women and young people. I think it is important that we try to take advantage of technology. We try to take advantage of what the world is doing. The Gambia is not isolated, and we must not even allow ourselves to be isolated. We are a sovereign state, a state that is now introducing democracy, a state that is is very fledgling, but we are trying all our best to see that we move forward to help the future direction and also to help the people and the young people to have a Gambia that we can for them to inherit and for them to grow and self-actualize. So all that it needs is to engage constructively. It needs us to be able to engage internationally, nationally, regionally, for us to build our capacities, for us to be relevant and also make use of these opportunities to improve our healthcare systems, our work, and our institutions for us to move forward.
Mr. Mark Wing, the American facilitator, thanked and acknowledged each attendee before giving a quick explanation of what Pocket Patient MD is. He also emphasized how simply the app can be used to track patients' medical histories and keep the track of the medications they are taking.
I'm going to go into showing what Pocket Patient MD is. Pocket Patient MD is an electronic medical record platform that's active across Africa. But one of the things that makes it unique is the ability to not only strengthen healthcare systems, but to also give doctors, ministries of health, and other organizations the opportunity to use this information to provide better care, to better track diseases, and to also secure the equipment they need, whether that's through the forms of grants and funding, or whether it's through donations, medications, and other types of equipment. There's obviously a significant shortage of physicians in most countries. There's a lack of access to information. If you ask ministers of health in many countries how many people have diabetes, how many pregnant women have gestational diabetes, how many people have cancer, the answer is often we don't know. And without having answers to questions like that, it's very, very hard to build resilient health systems. So with Pocket Patient MD, we tried to overcome this problem by doing a few things. First of all, by ensuring that it is completely free. So that makes sure it's universally accessible for any user, any organization, any doctor or Ministry of Health. The second thing is that it's customizable. Every country has different forms they need, different reporting techniques, M&E, monitoring and evaluation. With Pocket Patient MD, it can be customized to produce the monthly reports for the Ministries of Health as well as to assist with other research. I know that there's somebody that's involved with statistics here. This can link with DHIS2. And what you'll see with this platform is that, unlike with DHIS2, it takes an approach where we focus on the doctors and the health workers first. So instead of jumping directly to statistics, we let the doctors and the health workers, whether they're an actual physician or a community health worker, even a midwife, give them the tools that they need to do what they're doing, and on the back end, give all the other users the ability to have the information they need, to have more accountability, more transparency, and a greater impact.
During the training session, participants had the opportunity to offer feedback and pose questions. They also emphasized the significance of the app because the majority of them lack personal or medical information, and they expressed their desires that the Ministry of Health should make the app available and usable in the rural areas in an interview.
Like I said in there, I think it's good to centralize, decentralize it that way, because as I'm sitting there, I'm thinking there are women, there are people in the provinces that don't have access to this unless they come to Banjul. So I think if we decentralize it and then the doctors in the provinces also get it, I think it'll be very good. It will make things run smoother, easier, because by the time you take all the records, it takes time. Maybe the person is very ill, so but now that the records are already in one place, if we decentralize it, doctors can reach it and then be able to treat you faster.
This will assist our women to know of their sickness and get a record of their medical history and medical data. So that when they get sick, as soon as they're into a local hospital out there or any other hospital, the doctors will have access to their medical data and medical history, and in fact medical literature, because this is lacking in the country. Many women are being diagnosed with wrong diseases because of lack of medical data. And if this app reaches these areas, it will prevent a lot of deaths.
So the app is very good and is very secured, as from the explanation of the expert. So it will help in communication between the healthcare workers who are giving care to the patients, and also it helps to reduce the time. So if you use the app, the time that you need to see, the number of patients that you need to see with the app, it's more than when you are using the paper base. So it's very, very effective and it's very efficient. And also it helps for the data, the compilation and the storage of data. That is also very, very important. So it will help in terms of decision and policy making. It's very, very important, and it will help to improve the healthcare sector in the sense that easy retrieving of the patient file or patient records, that will be very, very efficient. Two, it also will help different healthcare workers to know how the patients are being managed and what drugs they are taking. Yes, often patients might not know which drugs they are taking. Some are not, do not have formal education. They have not gone to the English schools. Yes, so this app will easily help, and also it will help to maintain the confidentiality of the patients and the patient information.